Geriatric medicine is a specialty that focuses on the unique needs of the elderly. Dr. Phil St. John is a geriatric specialist. This caring and gentle man has chosen to focus his skills on helping the elderly live happily and productively, and to remain in their own homes as long as possible.
I've always liked older people. I've liked dealing with them. I've liked talking to them. They've had interesting life stories, and they're very complex people. So the medical issues require a fair bit of disentangling of the problems and identification of problems and addressing problems.
Geriatric specialists work with other members of the healthcare team on a consultative basis to help assess medical conditions, determine a course of action, and plan for long-term care. Research shows that most older people want to have their functional status extended.
So they want to go back home to gardening, they want to go back home to their kitchen, they want to go back home to their hobbies. Extending their life isn't usually their primary goal. If you look at most of our inpatient wards, some people do, of course, require long-term care, but the bulk of people get home. So the biggest outcome from our inpatient units is discharge to home. And that's true of all of the geriatric units in the city. We tend to try to avoid focusing just on the technology of care, but there should be a focus on what types of walking aids people have. That's largely within the physiotherapy domain, but we participate in that, as does occupational therapy. So getting somebody, not just a walker, but the proper size, proper fit walker. Some affordability comes in, of course, for some people, or a cane, or whatever is most appropriate.
In addition to ensuring the patient has the right tools, a geriatric specialist will help ensure there is appropriate and adequately trained attendant staff in place. In Manitoba, much of the geriatric care is delivered by primary care physicians, family doctors who've known their patients for years and are in an excellent position to assess new symptoms and changes. There is specialized training available to doctors who have an interest in increasing their understanding.
So I'll just take a quick listen to your lungs like we did on Friday there, okay?
Righto, yeah.
Righto. Geriatricians are really consultants. None of us do any primary care. All of us just do either consultants in day hospital, consultants in clinic, or consultants on inpatient services. We do a fair bit of the basic primary care and inpatient services, but then obviously when they go home, they go back to the family doctor. So that's also a very critical, important part.
A geriatrician will often visit individuals in their homes to help make assessments of need and recommendations for care.
So it's very important to assess a person in their own home. Not every person, not all the time, but it is important for a lot of people a lot of the time to see them functioning in their own home. So in Winnipeg, the section of geriatrics has been doing home visits really since the start.
In Canada, 75 to 80% of caregiving is done by the patient's own family, and determining their ability to access that support is an important part of the assessment.
I think where the geriatrician tends to come in is more in the later stages of a dementing process, or in the person with dementia and other health problems. And again, dementia is going to be a very substantial problem for the healthcare system to deal with, and not just the healthcare system, but also all the social services as well. So I think it's important at an individual level, but it's also important at a societal level how we deal with older people. And the key thing is we need to include them. We really can't exclude them from life. The flip side of that is that there's a lot of important things that older people do. It's not just a benefit for the older person to be included in society, it's a benefit for society to include older people.
Dr. St. John is quick to point out that he believes geriatric medicine is an excellent choice for a physician.
I think most of us enjoy the patient contact. So it's one of the areas where we do have a lot of contact with patients, and not just patients, but the healthcare team as well. And most of these patients have had very interesting lives, have seen a lot more things than we've seen in our personal lives, and it's worth sitting down and talking to people. And we're in a privileged position that we can actually get to know most of our patients fairly well.
Caring for the elderly and ensuring that they have a good quality of life is a goal we can all agree on. Both family doctors and geriatricians share a commitment to exceptional care for those who deserve the very best.